Hello, and welcome to the section on memory. In this topic, we will cover working memory, long-term memory, how memory is encoded, stored, and retrieved, the malleability of memory, the misinformation effect, and a little bit about memory disorders. So, what does it mean when we say memory? What are some factors that might impact memory? There are two kinds of memory, short-term and long-term. Short-term memory is whatever you are currently thinking about or paying attention to. Without practice or rehearsal, information that is in short-term memory will soon be forgotten. Practice and rehearsal can move the information into long-term memory. Long-term memory is where information is stored for an extended period of time, usually a lifetime. For example, if we're talking about short-term memory, an example might be if you have a class in a building and it's always in the same classroom, except this one time the front desk tells you the classroom number has changed for this meeting. So you repeat it to yourself until you get to the correct room. 6 weeks from now, you may not recall the one odd room that the class was held in. But if once a month you did need this information, you would eventually store it in long-term memory. On the 1 week a month when you needed this information, you would recall it or activate it back to short-term memory. An example of long-term memory would be lifetime memories. And a note on this, even though it is in our memory, we may not be able to easily access it. Sometimes thinking about it in a different way may help us to recall that information. Think of something related to what you are trying to recall. Before cognitive psychology, which studies memory, was officially recognized as a formal school of thought, Hermann Ebbinghaus conducted early research on memory in the late 1800s. Ebbinghaus evaluated his own memory by trying to memorize lists of nonsense syllables made up of random letters, like FEC and LEB. He memorized lists of these nonsense syllables and would then go varying periods of time, sometimes hours, sometimes days, before testing himself on the list again and seeing how long it would take him to relearn a previously memorized list. He discovered what he referred to as a forgetting curve. We'll talk more about this later, but in general, this means that most forgetting occurs relatively quickly and immediately after learning. From there, additional forgetting occurs more gradually over time. Ebbinghaus concluded from his studies that when individuals learn something, they will eventually forget large chunks of that information if they do not practice or make other efforts to retain it. Do you see any applications of Ebbinghaus's research in your life? When we start a new task or learn a job-related task, we often feel like we're being bombarded with information. According to Ebbinghaus, a good amount of that information will be forgotten almost immediately. The rest may be slowly forgotten over time if we do not have a chance to practice the skill or engage in other efforts to remember and retain this information. This has clear implications for tasks that we might not perform as routinely and offers suggestions on how employees can be more effectively trained. Whenever possible, we want to practice new skills. If hands-on practice is not possible, we might instead engage in simulation or brief refreshers on the information. Encoding, storage, and retrieval are the three pieces to understanding how memory works. Encoding involves the information or the input of information into the memory system. Storage is the retention of the encoded information. Retrieval is getting the information out of memory and back into our conscious awareness. Individuals encode information by putting it into a form that their brain can store and put away for future use. When a situation arises where they need the information, the process of the brain locating and activating the information is called retrieval. So when the brain receives information from the environment, it labels and encodes it, it organizes it with other similar information, and connects new concepts to existing concepts. Encoding occurs through two types of processing. Automatic processing is encoding of details like time, space, frequency, and the meaning of words. It's usually done without conscious awareness. Think about this as remembering when you last studied. Effortful processing is encoding of details that takes time and effort. For example, what you last studied, or learning new skills. When you first learn new skills, such as driving a car, you have to put forth effort and attention to encode information about driving. Once you know how to drive, you can encode additional information about this skill automatically. Semantic encoding is encoding of words and their meanings. This is the most effective form of encoding. Attaching meaning to information makes it easier to recall later. This involves a deeper level of processing. Visual encoding is encoding of images. Words that create a mental image, such as car, dog, or book, which are concrete words, are easier to recall than words such as level, truth, and value, which are abstract words. Acoustic encoding is encoding of sounds. Self-reference effect is the tendency for an individual to have better memory for information that relates to oneself in comparison to material that has less personal relevance. Storage is the creation of a permanent record of information. The Atkinson-Shiffrin model of memory goes over this. So information passes through 3 distinct stages in order for it to be stored in long-term memory, based on the belief that memories are processed in the same way that a computer processes information. There's a sensory input, then either it is transferred into short-term memory. So we have sensory memory. The information is either sent to short-term or it is lost. So if it's transferred, it goes to short-term. Short-term, if it's rehearsed, it will stay, we will learn it, it will eventually get to long-term memory. Or if it's not transferred or practiced, it will be lost. Sensory memory is storage of brief sensory events, such as sights, sounds, and tastes. This is stored for up to a couple of seconds, the first step of processing stimuli from the environment. If the environment is not important, it is discarded. If the information is valuable, then it moves into our short-term memory. Here is an example of the Stroop effect. This was discovered while studying sensory memory and describes why it is difficult for us to name a color when the word and the color are different. For example, in the left-hand column, we have red, orange, green, yellow, purple. But to say the colors is a little more difficult because our brain wants to read the word. So instead of in that left column saying the actual words, saying the colors is more difficult. It would be saying blue or orange or blue or purple or red. It feels awkward, right? Because it doesn't match. And our brain wants to make sense of this. So short-term memory or working memory is temporary storage that processes this incoming sensory memory. It lasts about 20 seconds. The capacity is usually about 7 items plus or minus 2, and this was discovered by George Miller. Short-term memories are either discarded or stored in long-term memory. Memory consolidation would be transfer of short-term memory into long-term memory. One way memory consolidation can be achieved is through rehearsal. Rehearsal is the conscious repetition of information that needs to be remembered. Long-term memory is the continuous storage of information. It has no limit, and like the information you store on the hard drive of a computer, it works kind of that way. There are 2 components of long-term memory, explicit and implicit. And in this graph, we see how long-term memory is either explicit or declarative, or implicit or non-declarative. Then that's split into 4 additional categories. So for explicit or declarative memory, we're talking about episodic or experienced events, semantic or knowledge and concepts, and then for implicit, we're talking about procedural, such as skills and actions, or emotional conditioning. So explicit or declarative memory is involving memories of facts and events we can consciously remember and recall and declare. So explicit memories include 2 types. Semantic, which is knowledge about words, concepts, and language, like knowing who the president is at any given time. Or episodic, which is information about events we have personally experienced. For example, remembering your 5th birthday party. So this is the what, where, and when of an event. It's also called autobiographical memory. A small number of people have a highly superior autobiographical memory, and this is known as hyperthymesia. Implicit memory is memories that are not part of our consciousness. They're formed through behaviors. This is procedural, so stores information about how to do things, skills and actions. For example, how to ride a bike, or tie your shoelaces, or how to drive. Implicit memory also includes behaviors learned through emotional conditioning. You might have a fear of spiders, but not consciously remember why or what occurred to condition that fear. So how do we get information back out of storage? Well, through retrieval. This is the act of getting that information out of memory storage and back into our conscious awareness. Retrieval is needed for everyday functioning, like knowing how to drive to work or how to perform your job once you get there. 3 ways to retrieve information: recall, recognition, and relearning. So recall is being able to access information without cues. This might be used for something like an essay test. Recognition, being able to identify information that you have previously learned after encountering it again. This might be used for a multiple choice test. And then relearning. This would be learning information that you have previously learned. For example, after learning Spanish in high school, you might forget how to speak it if you don't use it. However, if you try to relearn it, you will learn it quicker than you did the first time. Laschian engrams. Looking for evidence of an engram, or the group of neurons that serve as a physical representation of memory. So these researchers wanted to find a physical part of us that had to do with memory. So they studied parts of the brain involved in memory by making lesions in the brains of animals such as rats and monkeys. They trained the rats to learn their way around a maze, and then they made lesions to try to remove that memory. These researchers were unable to find evidence of an engram. The rats were still able to remember their way around the maze, so he formed a new hypothesis. The equipotentiality hypothesis is that if one part of the brain involved in memory is damaged, another part of the same area can take over that memory function. Kendall is a researcher who studied the synapse and its role in controlling the flow of information through neural circuits that is needed to store memories. So here on the next slide, I'm going to show a photo of a few different animals, and then we'll answer a question about them. I'm going to wait about 15 seconds. So in that group of pictures, how many animals did not have fur out of 20? Think about that for just a second. So how many animals did not have fur out of 20? 7. 7 animals were birds, so they had no fur. Now we'll talk about the amygdala and the hippocampus. The amygdala is involved in fear and fear memories. Memory storage is influenced by stress hormones. It also processes emotional information important in encoding memories at a deeper level and memory consolidation. The hippocampus is associated with explicit memory, recognition memory, and spatial memory. It projects information to cortical regions that give memories meaning and connect them with other memories. It's involved in memory consolidation. Also, damage leads to an inability to process new declarative memories. There is a patient called HM in the history of study of memory who is well known for having both temporal lobes removed, including the hippocampi, to help control his seizures. His declarative memory was significantly affected. He could not form new semantic knowledge or episodic memories. The cerebellum plays a role in processing procedural memories, such as how to play the piano and classical conditioning. Damage prevents classical conditioning, such as an eye blink in response to a puff of air. The prefrontal cortex appears to be involved in remembering semantic tasks. PET scans show activation in the left inferior prefrontal cortex when completing semantic tasks. Encoding is associated with the left frontal activity. Retrieval of information is associated with the right frontal region. Communication among neurons via neurotransmitters is critical for developing new memories. Repeated neuron activity equals increased neurotransmitters in the synapse, which equals stronger synaptic connections. This is how memory consolidation occurs. Neurotransmitters involved in memory include epinephrine, dopamine, serotonin, glutamate, and acetylcholine. The arousal theory is that strong emotions trigger the formation of strong memories, and weaker emotional experiences form weaker memories. Strong emotional experiences can trigger the release of neurotransmitters, which strengthen memory. This is evidenced by flashbulb memories, an exceptionally clear recollection of an important emotional event. Now for some more memory practice. On the next screen, I will show another photo of animals or pictures, and we will answer questions about them. So, of those 4 pictures, how many had houses or cabins featured in them? How many had water included in the picture? How many alternative energy sources did you notice, if any, in any of the pictures? So, 3 pictures had houses or cabins featured in them. 2 of the pictures had water included in the picture. And then, how many alternative energy sources did you notice, if any, in any of the pictures? We could say 2, because there is a wind turbine and perhaps the stream could be used for water power. So talking about flashbulb memory and the ways that this memory is recalled or imprinted. So this is kind of a record of an atypical and unusual event that has a very strong emotional association. Most people can remember where they were when they first heard about the 9/11 terrorist attacks or when they heard about the COVID lockdowns. So talking about amnesia as a memory disorder, and we will talk more about different memory dysfunction when we go over some abnormal psychology topics later in the course, but for now we're going to talk about amnesia. This is the loss of long-term memory that occurs as the result of disease, physical trauma, or psychological trauma. There are 2 common types. Anterograde amnesia, which is the inability to remember new information after a point of trauma, and this is commonly caused by brain injury or trauma, and the hippocampus is usually affected. This causes an inability to transfer information from short-term memory into long-term memory. Retrograde amnesia is a loss of memory, either partial or complete, for events that occurred prior to the trauma. So in the chart below, you can see the event in the middle, and then the 2 different types of amnesia, showing that retrograde is forgetting before the event, and anterograde is not being able to form memories for after the event. So memory construction and reconstruction. Construction is the formation of new memories. Reconstruction is the process of bringing up old memories. When we retrieve memories, we tend to unintentionally alter and modify them, resulting in inaccuracies and distortions. Suggestibility is the effects of misinformation from external sources that leads to the creation of false memories. This can cause people to claim to remember something that was only a suggestion that someone made. Memories are fragile, making them vulnerable to the power of suggestion. An important area of study has been the role of suggestibility in eyewitness statements. Eyewitness identification and testimony is often used in the prosecution of criminals. Research suggests that suggestive police identification procedures can lead to alterations in an eyewitness's memory, leading to misidentification. In studying cases where DNA evidence has exonerated people from crimes, the Innocence Project discovered that eyewitness misidentification is the leading cause of wrongful convictions. So exoneration is when someone is found guilty of a crime and then later found to be not guilty. So they are dismissed. The crime is dismissed and they are considered innocent. So the chart on the right shows the 4 leading causes of wrongful conviction in DNA exoneration cases. By far, more than almost 3 times more than the third leading cause is, or the fourth leading cause, is eyewitness misidentification. It's almost 80% of the time. That's crazy. Forensic science is second, false confessions are third, and then an informant giving incorrect information would be fourth. Here we usually discuss in 4 different groups these different questions. The first is memory accuracy. How reliable do you think eyewitness testimony is in police lineups? What factors can influence the accuracy of a witness's memory? The second is lineup composition. What impacts do you think the composition of a police lineup, such as the number of people, similarities among suspects, what do you think those factors have on a witness's ability to identify a suspect accurately? Then, legal implications. What are the potential legal consequences of relying heavily on eyewitness testimony in court? Should reforms be made to the way police conduct lineups and questioning? And then, cultural considerations. How might cultural differences affect memory recall and identification in police lineups? Are there certain practices that could improve the accuracy of eyewitness testimony across diverse populations? These are interesting questions to think about. Consider these as we move on in the lecture. Here is a brief excerpt of a study that questioned the accuracy of police lineups. They found that witnesses should not look at a group of people all at once to pick a perpetrator. In Washington, D.C., a study came out that says lineups that you see on television crime dramas and often those used in real-life police departments are going about it all wrong. The study released by the American Judicature Society is part of a growing body of research during the past 35 years that questions the reliability of eyewitness identifications under certain circumstances. That research has been taken more seriously in recent years with the evolution of DNA evidence clearing innocents of crimes they were convicted of committing, often based on eyewitness testimony. This new study finds that witnesses should not look at a group of people all at once to pick the perpetrator. Instead, they should look at individuals one by one, with a detective who doesn't know which is the real suspect. This is called a double-blind lineup. And this avoids giving the witness any unintentional clues or cues, preferably on a computer, to ensure appropriate random procedures are used and to record the data. So the study found that witnesses using this sequential method were less likely to pick innocent people who were brought in to fill out the lineup. The theory is that witnesses using the sequential lineup will compare each person to the perpetrator in their memory, instead of comparing them to one another side by side to see which most resembles the criminal. More memory practice. On the next screen, I'll show another photo of animals and then ask a question about them. How many animals of the 12 pictures had horns? Three of them had horns out of 12. 3 out of 12. So, have we heard of the misinformation effect? The misinformation effect was studied by Elizabeth Loftus, who studied false memories. The misinformation effect paradigm was that after exposure to incorrect information, a person may misremember the original event. So they asked college students to estimate the speed of cars using different forms of questions. Participants were shown films of car accidents and were asked to play the role of eyewitness and describe what happened. They were asked about how fast were the cars going when they smashed, collided, bumped, hit, or contacted each other. Participants who heard the word smashed estimated the cars were traveling a lot faster than those who heard the word contacted. If they heard the word glass, they were more than twice as likely to say they remembered seeing glass, which was a false memory. The implied meaning of the word used influenced the participants' memory of the incident. So when people are asked leading questions about an event, their memory of the event may be altered. And here on the right, we can see a chart showing some of the information from this questioner's um, study. So you can see smashed, collided, and bumped are much more perceived speed than hit or contacted. A controversial topic within psychology is the idea that whole events can be repressed or falsely recalled. False memory syndrome is the recall of false autobiographical memories. Repressed memories. Some psychologists believe it is possible to completely repress traumatic childhood memories such as sexual abuse. This can lead to psychological distress in adulthood. Some believe that these can be recalled through hypnosis and guided imagery techniques. Loftus challenges the idea of repressed memories and questions if recalled memories are accurate or whether the process of questioning and suggestibility leads to the misinformation effect. Forgetting. Why do we forget? Forgetting is the loss of information from long-term memory. This could be because of an encoding failure, which occurs when the memory is never stored in the long-term memory in the first place. So maybe it never made it there. Successful encoding requires effort and attention. Can you tell which coin below is the accurate depiction of a US nickel? Most Americans cannot tell which one because we do not encode the specific details. We just know enough to differentiate it from the other coins. Which one do you think is correct? The correct nickel is C. Memory errors. Schachter's 7 sins of memory. The first is the forgetting type. This could be from transience, which is the accessibility of memory decreasing over time, or storage decay. Absent-mindedness. This is forgetting caused by lapses in attention. Then blocking, where the accessibility of information is temporarily blocked, like the tip of the tongue phenomenon. Then there's the distortion type. Here we have misattribution, where the source of the memory is confused. We have suggestibility or false memories, and we have bias, which are memories distorted by our current belief system. Then we have the intrusion type. This could be persistence, so an inability to forget undesirable memories. So discussing transience or storage decay. Over time, unused information tends to fade away. Ebbinghaus studied this process of memorization, and the Ebbinghaus forgetting curve shows how quickly memory for new information does decay. It's 50% after 20 minutes and 70% after 24 hours. It happens a lot quicker than you might think. So according to Schachter, your feelings and views of the world can distort your memory of past events. Stereotypical bias involves racial and gender biases. After presenting people with a list of names, they more frequently incorrectly remembered typical African American names to be associated with the occupation basketball player and typical white names to be associated with the occupation politician. Egocentric bias. This involves enhancing our memories of the past. People remember events in a way that makes them look better. Hindsight bias. This is the tendency to think an outcome was inevitable after the fact. Kind of thinking that, oh, you knew it all along. Many veterans of military conflicts involuntarily recall unwanted or unpleasant memories. Individuals with PTSD or post-traumatic stress disorder may experience vivid, distressing recollections of traumatic events that intrude on their thoughts in daily life. These memories can feel as if they are happening in the present, leading to intense emotional and physical reactions. The overwhelming nature of intrusive memories can hinder one's ability to focus, analyze options, and make informed decisions. Individuals may avoid situations that trigger memories, which could impact their ability to engage fully in life. Interference. Sometimes forgetting is caused by a failure to retrieve information. This can be due to interference, either retroactive or proactive. This chart outlines this theory. For example, you could learn a combination to your high school locker. Proactive interference would be when old information hinders recall of new information. The memory of your old locker combination would interfere with the recall of the new gym locker combo. Or learning your sibling's new college email address. Retroactive interference would be that new information could hinder the recall of old information, so knowing that new email address could interfere with recalling the old one. Here's some more memory practice. On the next screen, I will show a picture or pictures, and then we'll answer some questions. So, how many shapes were there in each vertical row, up and down? How many shapes were there in each horizontal row, or left to right? How many shapes were filled in yellow? Well, how many were there in each vertical row, up and down? There were 5. And how many shapes were there in each horizontal row, or left to right? There were 4. And how many shapes were filled in yellow? 1. So here are some ways to enhance memory. Rehearsal, conscious repetition of information to be remembered. Chunking, organizing information into manageable bits or chunks, like separating phone numbers into 3 chunks or 3 sections. Elaborative rehearsal. This is a technique in which you think about the meaning of the new information and its relation to knowledge already stored in your memory. Mnemonic devices. These are memory aids that help us organize information for encoding. One way to remember the order of the planets is the name Mr. Vem J. Sun. Other techniques can include expressive writing or saying words aloud. Here is a mnemonic device example. This is a knuckle mnemonic to help you remember the number of days in each month. Months with 31 days are represented by the protruding knuckles, and shorter months fall in the spots between the knuckles. Ways to study effectively using some of these techniques. 1. Use elaborative rehearsal. Link information to other information or memories to make it more meaningful. 2. Apply the self-reference effect. Make the information personally meaningful to you in some way. 3. Don't forget the forgetting curve. Keep studying to prevent storage decay. 4. Rehearse. 5. Be aware of interference. Study without distractions. 6. Keep moving. Aerobic exercise promotes neurogenesis, or growth of new brain cells in the hippocampus. 7. Get enough sleep. The brain consolidates memories while sleeping. And 6. Make use of mnemonic devices. Thank you for listening. That concludes this section.